Last week, a mom came to me with some concerns about her daughter's pelvic floor. Has a diagnosis of lichen planus, actually lichen sclerosus. Both of those things are considered autoimmune disorders of the skin of the pelvic floor. Very uncommon to see that in a child under the age of 10. So she was looking to see if there was anything that I could do for that skin. She was using the steroid creams and feels in her mama heart that that's not good enough. And so what I told her, I used to treat this condition in the Pacific Center for Pelvic Pain with older adults, which you can see that. And the strategy there, and the same thing with this child and mama, was these are the nerves that come out the spine that are going to come to innervate the skin of the pelvic floor. They all have to come from here around. Anywhere in this spine that you can unload the nervous system, this is parasympathetic regulation. Rest, digest, enjoy your food, you feel safe, you get enough sleep. These nerve roots. So I showed her how to do a fascial release to the sacral area. And then when we traced up the spine, for this little girl, there was a lot of fascial restrictions at the occiput and then the ears. So, and then also the back of the thoracic spine, which is where you're going to get the fight or flight response. So the homework that I gave for this mom, and I treated both of them to show her how to treat her daughter for 10 minutes a night, maybe a couple times a week, was a fascial release on both sides of the lumbosacral plexus, the pelvic floor, so we could get the sacral nerve roots to innervate the skin as best as possible. Innervating the skin, opening up the lymphatics for any immune or autoimmune triggering of the neural regulation of the pelvic floor to the skin. Fascial release here, the back of the thoracic spine, the ears, and the skull. Anywhere on this cord, if there's an injury up here, it's going to pull up. And also the shins. The shins can pull all of this down. So just like this shade over here, if you have an upper injury to the upper part here, birth injuries, whiplashes, ear infections, it's going to sort of reflexively draw the tissue of the spinal dura of the whole sac this way, which leaves you less ability to have these nerve roots come to the skin. So doing a fascial release here is going to allow this to have more tissue to come down to the pelvic floor. So if you're suffering with your child or yourself, lichen sclerosus, lichen planus, even eczema and stuff, anything that you can do to take off this whole cord dural tension and fascia to get the nerves to the skin is going to help.